Hi, my name is Katie Davis, and I am a breast imager and assistant clinical professor of radiology at Vanderbilt University Medical Center. And I'd like to spend the next couple minutes discussing the importance of male allyship. I am thrilled to be joined by one of my favorite male allies, our chair at Vanderbilt, Dr. Reed Omary. Reed, thank you for being here.
Dr. Davis, it's an honor. Thank you.
So I'd like to start by speaking about allyship, which probably should define for the audience. So it can be considered a longitudinal process in which a person in a position of power, such as yourself, Dr. Omary, assists a marginalized group, maybe someone like me, a female, or a minority radiologist. And as I said, you've been a great ally to many, and I'm just curious to hear, in your opinion, what makes a good ally?
Well, I think the underlying basis for being a good ally is like much of what we do in medicine, and it's about caring. It's about having shared values and trying to make the world a better place, whether we do that for our patients, whether we do it for our trainees or our colleagues. I think it's just natural about who we are in radiology.
Yeah, and I would add, as someone who might be searching for an ally, I might seek someone who would be considered a trustworthy confidant, or someone who would amplify my ideas, or maybe even a mentor. And speaking of mentors and mentorship, Reed, let's say a female radiologist is searching for a mentor. Can you hit on two topics? One, why is having a mentor important? And two, what advice would you give this female radiologist in finding a mentor, particularly if she finds herself in a practice that is male dominated?
So I think when we look at the history of civilization, successful people almost always have mentors. And it's usually plural, and it may have started at a young age. It may have come in and out, but I think it's absolutely a recipe for success. And if we, another way to say that is, we as individuals are the products of our mentors. If you really want to think of ourselves as that we have collected the accumulated wisdom of those around us. And so I would say that it really is essential. That's whether it's in radiology, whether it's in medicine, whether it's in the arts, sports, business, really any field. Second, and then how to go about that, especially in a department that might be more male dominated, is to start by developing a network. And the network is key. The network can be within a department. It can be outside of a department. It's best if that network is far and wide. And think of the network as the team that's helping us to succeed. And it requires often conscious effort to develop that. And it's something that time and time again will come back to pay dividends in ways that we may not even be able to determine right off the bat. And so from the network, we can then call who we might consider our mentors. And I'd like to consider them plural. We should all have a series of mentors rather than just one person.
Yeah, and I'd also like to highlight the importance of perhaps having a formal mentorship programs, which, you know, mentors and mentorship programs are so crucial for women. And we often experience barriers in our career advancement. We're less likely to be seen as in higher faculty ranks or positions of leadership. And as a chair who has made an intentional effort in our department to bolster female leaders, what advice would you give your male chair colleagues or other men that are in a position of power to implement a mentorship program specifically geared towards women?
Well, I would view it as a incubator for leadership. So when we mentor women, what we're really doing is cultivating leaders, and as leaders, the women will help advance every single mission that the department is trying to accomplish. So it's really a ticket to success, and we need to. I mean, there's many other reasons to do it. Fundamentally, it's hard to be successful without women. And we need more women leaders, and departments that get that and understand that will be the departments that succeed. And departments that don't, well, there's just not a very bright future for them.
Yeah. We know at times that mentorship may not be enough alone to sufficiently retain and promote women in medicine. But we know that sponsors or a person with significant influence or resources within an institution can help increase visibility and credibility and these professional networks that you speak of for women. So this ultimately, the goal is to get women promoted in medicine. So in your experience, Reed, what are successful ways to sponsor women and female radiologists?
It's a great question. And I would say directionally, there are a ton of mentorship programs with varying degrees of success. There are very few directed sponsorship programs. Like, how often do we hear that we're going to get together and we're going to sponsor women, and that's something that long before I became a chair, I was very committed to sponsoring the careers of others, and I would actually track it. I would actually track all the awards that I would expect my trainees to try and apply for. And then over time, that would just become its own engine for success, because success begets success. So what we do now at Vanderbilt Radiology, and it's mostly unseen. We have a whole apparatus in place where we nominate faculty and trainees for awards. And often that's actually happening completely anonymously. Like, we don't make a, it's not a transactional, hey, I'm going to nominate you for something, so you should feel good about it. It actually comes right down to what's the biggest gift that we can give is to do it anonymously. It's to help someone. And that's the ability to track what we're doing places it top of mind, and we actually have a target for how many prestigious nominations that we have for our faculty. So I would say for sponsorship too, there's another aspect, and that's to really have the best interests of the woman leader in mind, and to understand what their goals are. And often that sponsorship gets back to the notion of setting up connections. So helping a woman leader expand her network is actually a really practical way to sponsor their careers. Hey, I see you're interested in this. I hear what you're doing. Have you ever met so-and-so? And then would you like me to make that introduction? And I think if we start doing that, and it just becomes part of our daily practices, it really opens up the opportunity for success for women.
Well, it has been so lovely to have this thoughtful discussion about male allyship for female physicians with you today, Reed. I'd like to wrap up the discussion with an direct request to all of the male allies that may be listening. Please bring our names up in rooms full of opportunities. I promise we will not disappoint. Thank you for listening.
Thank you, Dr. Davis.